another episode of our mental health moments. My name is Linda Golick. I'm the health and well-being consultant at Amplify Health by Bellin, and I am so happy to be joined again today with Hannah Bauer. Hannah is one of our licensed behavioral health therapists here to discuss today's topic. So Hannah, welcome.
Thank you. How are you?
Good. How are you doing?
I'm good.
Good, good. I'm excited to jump into today's topic, and I think this has a variety of things we can really talk about today. So, our topic for our Lifesaver Wellbeing series coming up here, it's called Healthy Choices, Healthy Life. And we really wanted to examine specifically maybe what risky substances do to the quality of our life. But I think this can also be a broader discussion because I even think about how sometimes, cruddy, junky food has an effect on my
Yeah.
quality of life. So I think there's a lot to talk
hmm
about. So, Hannah, tell me what you think as far as the gamut of what risky substances do as far as how they affect our mental health.
Sure. I think they have a tendency, right, like to kind of blur the line between what's okay and what's not, right? So I think we get comfortable with a certain level. So like say alcohol, right? Like for a lot of people there's a certain comfort level like I'll have one or two and it'll be fine, but like it can be a slippery slope, right? And we tend to view things as either black and white, like either something's good or it's bad. Um I think it makes it hard when we are unable to kind of connect what choices am I making and how is this going to make me feel a few days from now? So I think it makes life harder. It makes things more complicated. It makes it really difficult to pinpoint like what is the choices that I'm making and what are the impacts on my life.
What's really interesting is that, and we were talking about this earlier, just the idea that sometimes the impact of the behavior that we don't always recognize. So you had mentioned that sometimes people will actually have more episodes of like being anxious or being depressed based upon, what they're putting into their bodies. Can you tell us more about
Yeah.
that?
Yeah, so I see it a lot with people that, they're not by any means abusing alcohol, right? But they, on the weekends, they like to go out with their friends and socialize and have dinner and like go out for a little bit after. And it's usually in that week following that they're noticing their anxiety is really high,
Mm.
right? And because I think sometimes there's that disconnect between, well, I was drinking on Saturday, I shouldn't feel bad on Wednesday. But really, it's just how that affects people's bodies, how it affects like how we think and how we perceive things. It really can have a lasting effect. And that's hard for people to admit, right? And it's not just anxiety, it's depression too. And I think typically that's more immediate. You feel that in those couple of days when you're probably hungover, not feeling the best. So it makes sense. But there's such a disconnect between I'm following the rules, I'm only drinking so many, I'm not drinking and driving. That's a healthy choice, right? And they're not understanding why they're feeling awful in the week after when really all of those choices have some sort of an impact, right? They're going to affect us in some way. And for a lot of people, it is more anxiety and depression. It's just, days after having a few drinks.
Mhm. What we often forget is that alcohol is a depressant.
Right.
So it really shouldn't, we should see the connection there
Right.
and that can have an extra effect on making someone feel
Yeah.
more depressed.
Yeah.
And I think it's different for everyone, and we're not here to say this is a black and white
Right.
thing and don't drink or
Right.
anything like that. Alcohol has its place, and
Yeah.
it's not the most terrible thing in the world or anything like that. We're just trying
Right.
to educate on the potential effects that it can
Yes.
have on
Yes.
people.
And recognizing
Um,
that you have a choice. It's Wisconsin. Everything we do includes alcohol. That doesn't mean you have to drink it or you have to drink a certain number. Like you always have a choice.
mhm. The other thing I really wanted to talk about today, because I think we're just hearing more and more of this, is vaping. So people certainly know that cigarettes are
Right.
a not healthy choice, and there's a risk of cancer and other health issues and
Mhm.
all those types of things. But for whatever reason, vaping seems to be like the trendy, it's
Yes.
okay, and you have your flavors, and it's becoming ever more used more by our young people too. People,
Yes.
because you can't smoke in a building, but you may go into the
Right.
bathroom and vape and that type of
Yes.
thing. So what are you seeing out in our communities as far as vaping, Hannah?
I see it's very popular, and I think it's often used as an alternative to smoking or honestly anything else. And I think there's a perspective that, well, if I'm doing this, this is healthier than if I was smoking or doing something else, when really, truthfully, still not good, right? And especially when you see teenagers vaping, it's just not a healthy situation. You know, by nature, teenagers can be impulsive. And again, they're not necessarily connecting what I'm doing and what I'm putting in my body with how I'm feeling, with the choices that I'm going to make after. So just getting stuck in that loop of, well, I'm doing something that I want to do and it makes me feel good. But when I don't have this substance, then I'm irritable and I'm angry and I'm looking to, like, when's the next time I can have access to this? And I mean, they're teenagers, right? So life is pretty inconsistent. They only have so much independence. And then they're stuck in that loop of doing sometimes reckless things just to be able to feel good for a little bit. And that's really young to start that cycle.
And of course, another factor, I think, with all of these substances is just the idea of peer pressure, right?
Yeah.
Like,
Hmm.
how do people kind of start to help themselves if they are that person that tends to be more of the follower, and I'm just going to do it because that's the people I'm hanging out with, or my friends are at
Hmm.
this party doing this thing. Like, what do you recommend for people to help themselves?
I guess it's kind of little things, right? Like it's slowing down a little bit. It's even just looking for opportunities to make a decision. Sometimes it does feel very all or nothing, and you just want to fit in and you just want your friends to like you. And so you feel like you have to do whatever it is that they say that they want you to do. But I encourage, especially teenagers, like slow down. Like what would happen if you said no? What would happen if you don't go to that party? Probably nothing major. And if it did, and these people are like not talking to you all of a sudden, like then they were never your friends,
Yeah.
and like that's a hard lesson to learn and nobody really wants to learn it. But that's kind of just the nature of being a teenager. Like you have to recognize opportunities to say no and then also figure out, okay, what do I need to do in order to be able to have this boundary for myself or say no or walk away. And I
Mm,
think that's, I mean, that's a life skill, but that's typically
yeah.
what I encourage people to do is it's okay to walk away from something.
Mhm. Yeah, absolutely. And it's not always a black and white, type of thing, and
Right.
and people have to think about what's best for themselves, or what they
Hmm.
want to do in every situation. But we just know that the choices we make are going to have an
Right.
impact. That's what we want to, try and remember.
Right.
Um, I wonder, how about the effects on the brain? The actual effects of what happens with the chemistry of our brain when some of these substances are coming in. What does that
Sure.
look like?
So I think I would relate it to being similar with being on your phone all the time, right? Like your brain is going to get used to, oh, like this makes me feel good. This is something that I enjoy. And then when it doesn't have that, it's seeking, right? Like I don't
Mm-hmm.
feel as good as I did when I had this thing. How do we get that? You become preoccupied, you become more impulsive, you become less tolerant of, just some of your everyday inconveniences because your brain is like, I don't feel good right now. And again, I think it's hard for, young adults, teenagers, just humans in general to recognize like, oh, I'm feeling this way because of the choices that I had made and I had gotten used to having this substance or feeling in a certain way when that would never be consistent. Like no one can just sit around and have these substances in an unlimited quantity. Like things are going to interrupt, and we have to have distress tolerance. We have to be able to navigate that. And I think, especially with things like vaping or alcohol or whatever it may be, we disrupt that because our brains just get so accustomed to having something that makes it feel a certain way when that was never realistic to begin with.
Yeah, yeah. So as much as people may think it doesn't have impact, it does.
Right.
It absolutely
Yeah.
does. And your brain is one of the major major things to be concerned about.
Yes. Yes. Especially teenager. Like you're young,
Mhm.
that's your whole life. And you making some of these choices, like you don't want to have a negative impact that affects you for the next 50 years. But I
Mhm.
think the caveat is teenagers don't think that way, right?
Yeah, right.
That's hard.
So really then for anyone, anyone who may be just kind of evaluating right now and thinking, well, maybe I am a little bit too addicted to something. And we're
Sure.
not saying that this is anything significant, but maybe you're just
Right.
evaluating and think, you know what, I do maybe drink more than I should, or maybe I am
Hmm.
vaping and I know that isn't great. What is your recommendation, Hannah, for how people can start to perhaps break that addiction or get help
Sure.
with those addictions? Like, where can they turn? What can be of assistance to them?
Sure. The first thing I usually recommend is just like slowing things down, right? I think it's always helpful to just take a step back every so often, even when things are going really well. I think it's always helpful to ask yourself, well, why am I making some of these choices? Like, what is this putting into my life that I'm willing to maybe rearrange things to make sure that I have this choice even available, right? So just questioning your motives for things. And then sometimes even with those answers, you have a clear path and you can say like, oh, this is kind of a problem, right? Like I'm willing to rearrange my schedule so that I can make sure at the end of the day, like I can have a couple of drinks. Ask yourself, is that healthy, right? I think it starts with a lot of self-reflection and having to be honest with yourself. And in terms of
Mhm.
resources, I think that there are a lot of resources available, even starting with talking to your doctor, right? Like
Mhm.
starting with just like a low stress conversation, being like, I'm noticing this about myself. How can
Mhm.
I start to make different choices, right? It's nice to just have ideas and then starting to train yourself to look for opportunities to make some of these healthy shifts and changes. Because it doesn't have to be all or nothing. No one's saying, like, if you're noticing a problem, cold turkey, stop everything, right? It's just finding like everyone has different levels of what's acceptable for their lives and what allows them to thrive versus you're just trying to get by, figuring out where those levels are for you and what you can tolerate in your life.
Absolutely. And if something feels off or you are questioning the quality of your life and you're questioning that you would like things to be better than they are, then this is your moment to really step
Right.
back and reflect on that and take some action to
Yeah.
making things better for yourself. And you don't have to do it alone.
Right.
Reaching out to a provider, confiding in a family member or a friend
Hmm.
that you want to do better, that's a
Yeah.
good way to start as well.
Yeah, and I think it's always helpful even just to say things out loud, right? That makes it
Mhm.
real. So once you notice and you're like, I want to make these changes, say it out loud. Sometimes it is nice to have a friend or family member that's there to listen, because again, that just reinforces like I'm seeing an area in my life where I want things to be different and I want to be able to do that and be accountable to do that.
Yeah, absolutely. Well, Hannah, I always appreciate our conversations. I just always appreciate your insight. You always just bring such a great perspective to what we're talking about. Any other thoughts today? Healthy choice, healthy life, other food for thought to leave folks with today?
I don't think so. I think that was good. Yeah.
Okay. Awesome. Awesome. Well, appreciate your insight. Appreciate you taking the time to have the conversation. And like we said, just don't be afraid to make some changes, get some
Yeah.
help. There's help out there, and you can live differently than you are if you would like
Yes.
to.
Yes. Nothing
So
is forever set in stone.
that's right. Awesome. Well, thanks to our viewers for joining us today. Please like, subscribe, share this podcast, and we'll see you next time. Thanks, everybody.